Thank you everyone for joining today's mental health forum. We are really delighted to focus on offering friends and family members of essential workers in the COVID-19 pandemic suggestions for how to support the workers and to support essential workers during this time. The forum series, we are held each week, 11 a.m. Eastern Time, out of the Harvard T.H. Chan School of Public Health. And we'll have a presentation today, and then we'll have a moderated discussion. Please post your questions using the Q&A feature on your Zoom. This is being recorded, and the recording will be available on the Harvard T.H. Chan School of Public Health website. Dr. Watson, who's our speaker today, has also created a handout based on the contents of her talk that we will post in the chat feature and is already available on the website. The discussion will be moderated today by Dr. Kristina Korte, who's a clinical psychologist and instructor at Massachusetts General Hospital and Harvard Medical School, and a research associate at the Harvard T.H. Chan School of Public Health in the Department of Epidemiology. And I'm really delighted to welcome our speaker today, which is Dr. Patricia Watson from the National Center for PTSD. People reached out to me asking us to do a forum for friends and family members of essential workers. The first person I thought of was Patricia. We've known each other a while. From when I worked at the National Center for PTSD. Like I said, she was my first choice, and I reached out to her, and she lives a different time zone. And so I didn't expect her to agree to do this because it is at a really early time for her, but she agreed, and I was really delighted. So just a few things about Dr. Watson. She is co-author of Psychological First Aid, which maybe people have heard of. So she's co-author of the Psychological First Aid Field Guide and Skills for Psychological Recovery Manual, which came out of the National Center for PTSD and the National Child Traumatic Stress Network. She's also co-author of the Stress First Aid, Self-Care, and Peer Support Model, which was originally designed more for military personnel, and it was originally named the Combat Operational Stress First Aid, and produced by the Department of Defense and the Defense Centers for Excellence. And since then, it's been adapted for many different groups: fire and rescue workers, rail workers, public safety personnel, healthcare personnel, and pretrial and probation personnel. She's also co-edited 3 books on disaster and behavioral health interventions, numerous articles on resilience and early intervention. She's been instrumental in guidelines in terms of how to respond to mental health in disasters, and especially around public mental health and resilience, many other things. So thank you, Patricia, for doing this for us, and I really look forward to your presentation.
Thank you too. It's a pleasure to be here. It's actually, for me, one of my, I would not want to be anywhere else, because this to me is a very, very important topic. I feel like the people who are interested in this and on the call today are really the ones who I really want to be speaking to right now. I know it hasn't been easy for you either, so happy to be here. So we have a lot to cover, and what I'd like to do is move along into the slides here real quick. What we know is that right now, frontline workers, essential workers of all kinds, are really being pressed and tested. They're always tested in disasters and public health crises. And so support from close family members and friends can really make a difference and be crucial in fostering their ability to endure and keeping them doing the work that they need to do and that we need them to do. And we also know that they're going through long hours right now, have concerns about being exposed to the virus themselves, have also having to take care of all of their ongoing duties, not just COVID-19 duties, but other things that they've already been busy with or are still in their schedules. There's a lot of uncertainty right now, and it can mean that day-to-day policies get changed, work gets changed, protective equipment gets changed, all kinds of messaging gets changed from day to day. So people are having to move with that and dance with that. Resources are sometimes scarce, and people aren't sure, what's needed, and they don't have access to what's needed. So that can make it a very difficult time for them. And we've heard over and over again that not only are people concerned about their own safety and their patient's safety, but they're worried about the safety of their loved ones, and whether or not their jobs are putting their family members and friends at risk. There's also concerns about what we call moral distress or moral injury. Let me speak to that in a little bit more detail. So what we're hearing, particularly for healthcare workers and people in hospital settings, are first responders, are that they're having to sometimes make life and death triage decisions and resource decisions as to how resources, excuse me, how resources are getting used and mobilized. Knowing that sometimes under different circumstances, a person's life or health could have been saved or preserved. And because we're in a pandemic, things are not as easily maneuvered, not as easily operated as they typically are. Some people may feel guilty because they're not wanting to show up for work or volunteer for dangerous rotations or assignments. And they may go back and forth between wanting to serve and also not wanting to put their family members or their own health at risk. They might be witnessing what they perceive as either unfair or unjustifiable acts that they are not able to confront for whatever reason. Some people, when they're under a lot of stress, they start to feel a bit numb, and they might feel guilty about not feeling as much empathy or compassion as they typically feel. If they're in a situation where people are not surviving because of the virus, they might feel guilt about that they're surviving and others are not. And many people are feeling torn between their family duties and their work duties. And so that can cause a sense of moral injury or conflict, inner conflict. We also know that it may be hard for essential workers to reach out and ask for help because oftentimes they have a strong service orientation. I'll speak more about that in a minute. They often have a lack of time. They're just overworked, and so they don't have the time to even sit down and figure out what they need, and also figure out when and how they'll have time to talk about that. Fatigue can cause people to just get in a mode of focusing on their work and not wanting to talk or think about the stress that they're under. Often they have difficulties even recognizing their own needs because of all their demands that they're under. There's a strong stigma for people that are in healthcare settings or first responder settings to, acknowledge or share that they might not be doing well. And they can sometimes fear that they are a burden on others, so they just keep things to themselves. And also, I think that asking for help is a social skill. You have to have a certain set of skills to ask for help. And oftentimes people who are essential workers are used to being the one who helps others. So they're not even used to asking for help or knowing how to ask for help from others. We know that people in settings like this often are guided by values and ideals. It's what brings them to jobs like this in the first place. And that can be a great blessing to them. Their ideals are often along the lines of being selfless and wanting to place others' welfare above their own, being very loyal and committed to accomplishing work missions and protecting others, having a certain stoicism and toughness and being able to endure hardships without complaint. They often follow an internal moral compass and a sense of choosing right over wrong. And they often have a sense of excellence in wanting to become the best and most effective professional they can be. So those things are wonderful. The jobs that people seek as a result of ideals like this allow them to enact these values and be with others who also have these values. And the jobs themselves can make these values stronger in them because they're living these values every day. But there's a flip side to this. This is why we call this the double-edged sword, that sometimes these values can also place them at risk and have them be more vulnerable because this selflessness, for instance, can result in not seeking help for their own problems because they're thinking of others above themselves. Typically, when I give a training to first responders or people in healthcare settings, I'll ask them, how many of you have not made a doctor's appointment for yourself that you should have made? And usually it's about half the audience will raise their hand because they're busy and they're thinking of others before themselves. Their sense of loyalty can cause them to have more guilt than others when they aren't able to do what they want to do or need to do to help others. Often their sense of stoicism can result in them not even tuning into their own needs. They're not even aware. They've kind of shut down their own check-in on themselves. So it will be because a family member or a friend says to them, I think you need to get some help. You're not looking good. That might be the only thing that will make them realize, oh, I'm not doing okay. And oftentimes they can be irritable, frustrated, angry if others do not live up to their values or their ideals. Customer service, for instance, if they go somewhere and others don't have their same value of customer service, they can get irritated and angry. Or they can feel like the concerns that their family members and friends have don't really live up to their concerns. And so it can sometimes shrink their sense of a social network and make them feel like they can only talk to other people in their job because those are the people that understand what they're going through. And lastly, they can sometimes be prone to feeling ashamed or trying to deny any imperfections in themselves because they have this value of always being the best and trying to do the best that they can. So because of this slide, it might make it difficult for them to reach out for help or even acknowledge that they need help. And so it's often upon family members and friends to point out to them when it might be good for them to take a break or get some help. We hear oftentimes there are certain attitudinal obstacles to people in jobs like this taking a break or getting help. Things like saying to themselves, it would be selfish if I took a break. Others are working hard, so I should. I'm okay, I'm fine. Sometimes they have an adrenaline rush in situations like this, so they're not even aware of being tired or needing to take a break. They feel like they feel fine, and so they'll override you if you tell them to rest or take a break. They can say to themselves, the needs of the people I'm supporting are more important than my needs, as I said in the prior slide. Sometimes they can feel like they're not doing enough or that they can contribute the most by working all the time. And sometimes they might feel like I don't want anyone to know how affected they are. They might feel like only they can do X, Y, or Z at work, so they better keep working and being available because they're the one that can do the best at a certain type of job. So we have developed a model that attends to worker stress, and it's called Stress First Aid. And we brought this model into existence in a military setting with Marines and Navy, and then we transferred it to fire and EMS and other first responder settings. But when we were first invited to develop this model, this stress continuum was already in existence in Navy and Marine Corps, and they developed this stress continuum in order to reduce stigma and to change the view of service members that either they were in the green zone, which is good to go, well trained, doing your best, or if they weren't in that green zone, it meant something was wrong with them. When in reality, what you typically tend to see in all settings is that people cycle in and out of different zones of stress. Even these zones are artificial, but they allow for a little bit more detail than just being green or red, which is what was happening before they invented this stress continuum. So typically what we see is that people in healthcare settings, first responder settings, military settings are in the yellow to red zones. I've given many trainings that I've had people raise their hand and say, can we just acknowledge that yellow is the new green? None of us is ever in the green zone anymore, because yellow zone is more where you're reacting to multiple stressors, either that are happening at work or at home. and all the double-edged sword vulnerabilities are at play. You tend to see a lot of mild or transient distress or impairment symptoms, things like changes in mood, loss of motivation, maybe loss of focus, maybe physical changes, reacting to stress. And when you move into the orange zone, typically it's the result of either a buildup of all these multiple yellow zone stressors, or the introduction of traumatic stressors, where there's life threat or something potentially traumatic in the environment. Loss could be occurring in this zone, or this moral injury that I spoke to. And we also acknowledge in this orange zone that there's a wear and tear kind of fatigue that happens when people are faced with multiple stressors over time without a break. And here in the orange zone is where you see more severe or persistent distress or impairment, usually kind of a loss of control of emotional reactions, or a person no longer feeling like themselves. And it's more significant, either more persistent or more intense in terms of stress reactions. When a person moves into the red zone, it's usually as a result of having to endure an orange zone situation for a period of time, or having a very significant orange zone stressor that's not healed, and they move into having more of a clinical kind of either significant stress or persistent stress. So what you would see in a pandemic type of situation, and I won't go into detail on this slide, this is a slide more for your reference. For a person who's operating in a healthcare setting, for instance, you would want them to be in the green zone, and I will map this onto the 5 essential elements in a minute. But when they're in the yellow zone, it's typically because they're not pacing themselves, they're not taking their job at step by step, and they're taking on too much. They might start to ignore drops in their functioning, or maybe not changing their expectations for themselves, not checking in with others, and they might be underestimating their needs and not adapting their self-care. So what I've seen in healthcare workers is that their way of taking care of themselves is to go out and run for 3 miles, but if they can't do that, they won't run at all. They won't do any exercise. So they start to drop off their self-care, and they're overriding their concerns of their family members and friends. Maybe there's no routine put into place for themselves, and they might get into unhelpful thoughts or habits, the ones that I mentioned earlier, these kind of attitudinal obstacles to self-care. And then you'll see kind of a movement towards orange and red if they continue with these patterns and they get stuck in them. Maybe they become more disengaged or isolated. Maybe they continue to overdo work and underdo taking care of themselves, and they're stuck in not asking for help because of stigma. And if you continue to see these patterns, you will be more likely to see a person operating in the red zone, and maybe engaging in more counterproductive behaviors like self-medicating or not seeking help. So that's how I see the stress continuum helping, because when a person can start to identify their own behaviors that might put them into orange and red zones, then they can start to take action and move back towards the yellow and red zones by taking, for instance, I'll just pick the yellow zone, where they take more of a marathon approach than a sprint approach, maybe build better healthy habits and start to set boundaries a little bit here and there, being more disciplined about taking breaks and identifying the ways they speak to themselves that aren't helpful, practicing more helpful thoughts, focusing on the little, toeholds of where they can have control, and maybe seeking help or support from others and building some resilience skills. So that's how I've seen people use this stress continuum in terms of self-care. And I also see family members and friends using the stress continuum as a way to have a shortcut to communicating with people. So we've had people even make a magnet of the stress continuum, put it on their refrigerator and say, okay, what zone are you in today or this week? And it gives you a way to talk about stress where you don't have to get into a lot of detail, but maybe can check in with each other a little bit more succinctly. So as I said, we came into a system where the stress continuum was already in place, and then they turned to us and said, okay, so How can you help us with this? Now that we have the stress continuum, what can you suggest to bring people from red to orange into yellow and green? So we brought in a model that was based on an expert panel that we had taking a look at what is helpful for people in situations of ongoing threat. And we pulled together a panel of about 50 people from around the world who had either been in disaster or other adverse circumstances and tried to help people in those situations, or were researchers with disasters and different types of traumatic stress and loss. And we asked them the question, what's helpful for people in situations like this? We presented research to them, and we, as a panel, we came up with these 5 elements that seem to be related to people doing better in situations of ongoing threat. And the 5 elements are helping people gain a better sense of safety, helping to calm them, giving them social support and helping them feel connected to others, helping them feel self-efficacy, which is a sense of that they can get through a situation. You know, they have the skills or the resources to get through it, and having a better sense of hope. And what we found is that people don't have to have all 5 of these, but if they have 1 or more, they tend to do better than people who don't have these things in place, have these elements in place for themselves. So we developed our model based on these 5 elements. I just want to make a quick note that it's also important to know that people have different coping strategies dependent upon their context. So the model that we developed was meant to be more of a framework of these 5 elements, and you decide the actions within each one of these 5 elements. So I'll speak to this very briefly. This is research that I find really interesting because it was with firefighters, where they found that firefighters were able, and fire and EMS were able to distinguish different coping strategies dependent upon whether they were in a high emotionally intense context or a low emotionally intense context. When they were in the middle of something very intense, they preferred distraction as their coping strategy. And that's where they disengage their attention away from what's going on inside themselves and direct it towards what's in front of them. Usually, what do they have to do in their work setting? When they have, they're in a less intense emotional context, they then move towards reappraisal strategies. And those reappraisal strategies are things like trying to give themselves time to really experience what they've been through, to integrate it, to make meaning of it, to confirm that, okay, that was really hard, but I'm going to continue doing the work that I do because of my values. And I'm going to focus on the fact that I'm safe now. I'm going to maintain my previous goals. I'm going to allow myself to continue to care for others, both at work and at home. I'm going to try to find ways to reduce any emotions that come up as a result of what happened. And I'm going to continue to use distraction and amusement and other activities in my life to offset and balance what happened and what was difficult for me on the job. When you find that people are able to use distraction in the middle of intense context, they have less distress. When they're able to begin to integrate and have these reappraisal strategies over time, they tend to have less PTSD over time. And what I see as problems are sometimes people will want them to reappraise a little too soon. They might be right in the middle of something. You may have experienced this with them where you want them to talk about something that's happening at work and they're not ready yet. And if they try to approach those feelings that they're having or talk about something in detail, they actually have more distress. I've also seen the flip side where people, once they get to a place where they could talk about it, they continue to use distraction. And distraction comes in all forms. So anything that takes their attention out of what's happening inside of them, it could be drinking, it could be Netflix, it could be, not thinking about themselves at all and only focusing on other people. Workaholism is another form of distraction. And when you see people never getting to those appraisal strategies, you tend to see higher rates of PTSD. So I find this research very important because it's important to be able to tell and show people that the pattern you would want to see is more like this, where they're able to distract, but once they get to a less emotionally intense context, then they can start to build in reappraisal. And it's tricky because you don't have just high emotionally intense context and then have a period of time where it's low emotionally intense context. Usually in jobs like this, you're going back and forth, depending on what's happening. So it can be really tricky. But as a family member and friend, if you know this, you can start to see, okay, they're still distracting. Maybe that's what they need right now. I'm not going to push them, but I'm going to try to find ways to help them get into more reappraisal when they can. So if you remember nothing else besides this talk, what I would suggest is that what could help is you help yourself have self-reflection and also help the other person to have self-reflection, where they're regularly, you and they are regularly asking these questions. What helps me to feel safer? How can I feel more calm? How can I do things to help me feel like I can get through this and persevere? What connections do I need? What are the who are the people I should be talking with right now? Do I need to add other people into my social network right now to help me get through this? And do I need to maybe stay away from some people and move towards other people? And lastly, with hope, what helps me have more hope? We know that that faith can help people have more hope. We know that a sense of optimism can help people have more hope. A sense of just being confident in themselves and the people around them. What do I do when it feels like everything is lost? How can I continue to endure through this and have hope through this? So these questions can help you be more reflective, can help the person be more reflective. And as a family member or friend who's supporting somebody, you can also ask yourself, what can I do to foster safety in this person and help them feel more safe? How can I help them feel more calm? How can I get them connected to social support? And what different ways do we need to support them right now? How can I help them feel like they can persevere and have more hope? And those should guide you, because it will be different for each and every one of you. As I said, every day you're going to have different strategies depending on what's happening. Your personality will guide which actions you take in terms of these questions. The relationship you have with the person who's in a healthcare setting or other setting will guide what you do about each of these questions. I can give you a few examples in the next slides, but you will ultimately be the one who decides, how does this look for me, and how does this look for the person who I'm caring about? So what we know is that we added onto these 5 elements in our model, we added check. So checking in regularly, trying to understand, looking for signs of stress in a person. And these are things like the person, again, showing signs that they're not in control of their emotions. Maybe they're having a harder time controlling anger, or they just go into a funk and they don't know how to get out of it. Maybe they're saying things that indicate they're no longer feeling like themselves, or they're not able to function as well at work or at home. And maybe you're seeing changes in relationships where they're more withdrawn. Maybe they have less sense of humor, or they're just feeling guilty because they can't spend as much time with you. Maybe they've increased drinking or other use of substances. So if you see things like this, then it would be important to point them out, let them know that you care about them and you're there, if they want to talk. Offer, different options for support, instrumental support, where you just give them practical assistance and things, take things off their plate. Maybe you are the person who has more time in your schedule, so you're searching online for information that might be helpful for them, so you can guide them or advise them about very specific things. Or maybe you're just there, showing care, reassuring them, having empathy for them in different ways, and giving them the care they need in that way. And each one of these slides has little examples. I won't go into detail, but you have those for your reference in the quotes in these slides. One of the skills we came up with in our model to check in on people is called Oscar, where if you have a hard time because you're asking a person how they're doing and they're saying, oh, I'm fine, I'm fine, I'm fine, what we would suggest is that you pay attention for patterns in their behavior. And when you have seen a pattern, you can say to them, I know you keep saying you're fine, but I'm noticing that you're more withdrawn, or you're no longer laughing, or you're really looking worn down. And I'm only saying this because I care about you. Am I right, or am I wrong? Is it is what I'm seeing based on stress, or is it something else? And you let them respond to you, and then you decide based on their response what would make the most sense. But knowledge is power here. If you know that person really well, you might be able to notice subtle things in them that other people don't, that would give you the entree to open up a conversation with them and say, I know you say you're fine, but I know you, and I don't think you're fine. So what do we need to do about that? And then you pick and choose in the model, uh, based on what you see and what they tell you, you pick what might be most helpful. So for cover, there's lots of different ways, but you're going to be asking them, what their preferences are. What would they need to feel more safe? Maybe you brainstorm with them, try to find ways to help them feel less threatened, or ways to feel more safe. Again, you could be looking online or trying to get sources of information to make them feel more safe, or keep track of resources for them, talk with others who might be going through similar situations to try to figure out what would help them feel more safe. And also be aware that one of the things that sometimes makes people in jobs like this feel unsafe is they feel that their own stress reactions are putting their relationships in harm's way. So they might feel, my God, I'm not a good partner anymore, and I'm not able to focus. I'm hypersensitive. I'm not able to be regulating my emotions. And they start to worry that their relationships are suffering. So one of your roles could be that you stay calm, you help the person know that you are there for them no matter what, that you're going to be supportive, and you give them consistent messages that, don't worry, we're in this together, we're with you. And that can help them both calm down, but also feel more safe within the relationship. Calming, there's a lot of overlap between cover and calm in situations like this. But here in this is, calling for you all to be very creative, because a lot of the ways in which you may have supported a person in non-pandemic situation might be taken away from you. You're no longer able to be close physically. So you've got to be really creative and figure out ways to calm them down. It might be helping them problem solve, figuring out ways that you can support them in calming themselves, via exercise, whatever it is for them that makes them feel more calm. You might be able to deliver a meal. You see in the pictures here a little message with a casserole where the family member figured out a way to deliver a meal to the person. FaceTime, helping them make lists for themselves, helping them download apps so they can do little relaxation exercises and that type of thing. Just giving them opportunities to vent. And we've had people say that they've figured out how to shortcut these conversations and say, okay, what kind of conversation is this? Do you need to just vent, or do you need me to help you? Because sometimes people don't want to know that you're trying to help them, and that makes them feel like they're more of a burden, knowing that you're trying to fix their problems for them. Maybe they just need to be able to say something and know that you're going to listen, and that's enough. Another thing you could be doing is helping them with self-talk. So if you see that they have these ways of talking to themselves that's making it harder for them to take care of themselves, you might be able to point that out to them and help them maybe talk to themselves differently. Sometimes when people get under a lot of stress, they can be very negative with themselves, and maybe you can notice that and help them figure out less negative ways that they can talk to themselves by saying things like, right now, none of us is at our best. We're all, everyone's going through a hard time. I know that you're really hard on yourselves typically, but this might be a time where you give yourself a break and be a little more patient with yourself, because it's really a time when nobody can be great at what they're doing. They just have to give themselves breaks. Okay, so connectedness, again, trying to find creative ways to show support. We have a few examples here in the pictures. There's a woman's daughter who came to the workspace, and they just stood apart from each other and kind of gave each other a virtual hug, being able to support each other through Windows or through Zoom and FaceTime, sending notes that people can, or posters that people can put up showing that you're supporting them. Helping them, again, solve problems and giving them practical assistance is sometimes extremely helpful in terms of social support. Helping them focus on the ways, and also you focusing on the ways that you can be grateful, so that you're also staying positive, and if possible, scheduling meaningful, positive activities into the schedule for the family so they know that the family is being taken care of at home. showing that you can tolerate their stress reactions, that you're okay, you're a buffer, and you understand that they're under stress right now, and so you're not going to react to their reactions. That you respect their duties, encourage them to socialize with mentors or people who are going through similar things so that they have that kind of support of people who understand what they're going through. And then finding really, again, creative ways to promote connection within family and friend networks. And just being a good listener yourself. I have a few slides here that I won't go into detail, but they're there for your reference about how to be a good listener and have good empathy. Balancing questions with silence, little ways to say, tell me more. Can you help me understand what you're going through? Often just being silent. Somebody pointed out to me that silent and listen those two words have the same letters in them. So just being able to be silent when a person needs your silence so they can vent. Learning how to reflect feelings and paraphrase back. So we have examples of how to do that, how to start a reflective comment. If somebody says something to you, you don't immediately jump in to give them advice. You first say something like, it sounds like you're really going through a tough time right now. And sometimes just making a reflective comment like that lets a person know you've heard them, and they can know that you have empathy for them. And then it allows them to open up even more. Supportive comments, we have kind of sentence stems here that can help you figure out ways to have supportive comments and empowering comments like, are there any things that you think would help you feel better? Or what have you done that's helped you get through situations like this in the past? So then we have do's and don'ts for building connections with people. And so I'll let you take a look at those when you have more time. And then moving into the next core action of stress first aid, helping people build a sense of competence or that they can get through this situation. As you can see, we renamed those 5 elements so that they each started with the same letter. So self-efficacy became competence in this sense. And these are actions that you take that support a person feeling like they can do things that are within their control, or take tiny steps towards habits that are healthy for them, doing things one step at a time, breaking things down into small steps so that they feel like they're making progress, and encouraging them to do what they can do or what they need to do, not looking too far ahead, and encouraging them to pace themselves. Doing whatever you can to support them in any healthy coping strategies that they can take, even if they're just small things. We know that healthy habits often have to be broken down into very tiny steps. We have a couple of examples in quotes here. When the person's fatigued and frustrated, but still wants to contribute at home, I give them small things to do that are calming, like brushing the dog, and I tell her it's okay if she's frustrated, that she can't do more at home. That's all right. She's part of something bigger. And I'll say, let's not worry about home tasks. We've got it covered here today. We'll not worry about things like that. Let's just adjust our expectations and just do what we can do. So just trying, again, to encourage them to do whatever they can to feel better and to stay healthy. And lastly, the sense of hope we've called confidence. And here are ways to just try to build the person's sense of hope, optimism, faith. This is where you provide, support, where if they're getting stuck, you find more helpful ways for them to think about things, or help them shift and reframe how they're looking at themselves or the situation. Remind them that they're part of something bigger, helping them focus on what's going well, or what they might be grateful for, or how they're getting stronger, or how they are contributing, or how they can be inspired by the people around them. Maybe you'll be helping them find meaning in their experiences. And you might not be able to do this when they're in the middle of it. So some of these things, I'm really well aware on all of these slides that some of them will fit and some of these things won't fit right now. You have to figure out when you can use these strategies, or come up with your own strategies that fit within each one of these elements. If loss is happening, maybe you'll help them find meaning in that, or help them honor the losses that they're experiencing and help them express their feelings in whatever way makes the most sense for them. And if relevant, maybe you would be supporting them in with church or with religion, with prayer, with reflection, with faith, whatever it is for that person, reminding them of their values or of their faith, praying for them, telling them that you have people thinking about them, whatever that is for that person, that makes sense for you and for them. And lastly, there are some examples here of ways to have more helpful thoughts. This actually goes with helping them feel safe and covered, but also helping them feel more confident. So remember when I said people have these obstacles to self-care because of their thoughts? These are some examples of thoughts they could replace those thoughts with, such as instead of saying, I can't take a break, they can say things like, taking a break from this work will actually help me be more effective. So even if it means that I go into the bathroom and sit in a stall for 2 minutes and catch my breath and tell myself something a little bit differently, or remind myself of the things that matter to me, I do need to take these little breaks. And you might be able to support them in changing their thoughts like this. Even though I feel fine, I still need to pace myself. I can better care for others if I also attend to my needs. I'm actually doing enough. I cannot do more because it's going to be hurting me in the long run, and I have to take a long-term approach. So I can contribute more by pacing myself. And sometimes letting someone know how affected I am by my stress can actually help me. And I sometimes need to reach out for asking for help from others. And I can also trust that others are going to fill in when necessary, or that it'll be taken care of exactly how it needs to be taken care of if I'm not the one there who's doing the work. So anyway, these are just examples of thoughts that might be more helpful than those thoughts that I presented earlier. And lastly, I know this is a lot of material and it's a lot to go through, but just know that our model it's really a first aid model, and we're always really well aware that you can continue to try to, do some of these actions to support people. But if you feel like you've done these actions and they're still not working, or you're really worried about that person and you really feel like they need more than what you can offer, it's important to coordinate with others. Reach out and maybe get the opinion of other family members or friends, or get help from other family members and friends. Maybe you need to find resources that might be helpful if you have concerns and you feel like you're not able to provide enough support. So there are hotlines. I'm sure that healthcare settings have resources on their websites. You can reach out and figure out national resources as well. You may need to find creative ways to get support for this person. There are hotlines for people in high stress jobs as well, and they can reach out and talk to people. Maybe you might reach out to an old family member or friend who hasn't talked to that person in years, but you know that that's a person that your family member or friend who's in a healthcare setting can rely on that person, even though they haven't spoken to them in a long time. It's a person they trust, who they might be able to lean on at a time like this. And you also might consider professional support, either through chaplains or through healthcare professionals, mental health professionals, telehealth, that type of thing. And, it might be helpful for you to interview professionals to get a sense of how they could help. Some mental health professionals could consult with you about how you can be a better support as well. So you could reach out in that way as well. But always think in terms of coordinating, because there's a lot being placed on the people you love. And because of that, there's a lot being placed on you as well. So make sure that you're getting the support you need as well, in order to support the people you love. So I'll stop there and see if there are any questions. And as I said, you have some handouts to refer to. On our website, there are lots of other handouts. So we have specific handouts for healthcare professionals and people who are in leadership positions. There's lots of different materials on our website. If you're worried about that person developing PTSD, obviously the National Center for PTSD has lots of handouts about PTSD as well. So And we have webinars, we have videos and that type of thing. So I would encourage you to seek that support if you need it. So I'll see if there are any questions, and I'm not sure how to look at chat, so I'll see if I can, maybe you can give that to me.
Thank you, Dr. Watson, for that talk. That was a lot of really great information and a lot of really helpful tips for helping loved ones that are kind of the healthcare and the frontline workers. So we do have some questions that are coming through, and I would encourage the attendees to go ahead and put your questions in the Q&A chat box, and we'll get through, and I'll try to get through as many as possible. So I'm going to start off with, let's see, we have a question that's kind of focused on discussing kind of the stress continuum and the different zones that you discussed. And the individual is asking, since there's no deterministic timeline when the situation will taper off, how does duration of the COVID crisis impact the movement among the different time zones? So do people tend to stay in one zone, or potentially accelerate through the zone because of kind of the uncertainty of the situation?
That's actually a really good question. And what we are seeing is that right now there is no one way. So what I'm seeing is that people tend to cycle in and out of the zones depending on what's happening from day to day. And if they're getting support, maybe they'll go into the orange zone because of a particularly hard day, and then they'll be able to go back into yellow and green zones depending on what's happening and how much support they're getting. So I would think that people would be moving back and forth, but if they're having ongoing, heavy workload over a period of time, they're probably going to park in the yellow, orange, and red zone, depending on, they're not going to probably be in the green zone if it's just a day in and day out burden of lots of stress. So I would see that they would probably tend to move more towards orange and red if they have continual stress over time. And so yes, it's not any, zone they're going to. And I've also seen people live in the orange and red zone for years at a time, depending on their job. I've seen people with PTSD, which would be considered a red zone illness, but they're still able to function. They might be having nightmares, and they might be having, signs of and symptoms of PTSD, but they're still able to function. So just because they're in the red zone doesn't mean they cannot work, doesn't mean they cannot still be participating in family activities and that type of thing. And I think it's also important to point out that, because I see the other question here, which is, how do we help someone who constantly states they're fine, but clearly we know they're not? And again, this is what is frustrating for me about webinars, because I'd love to be able to just be in the room and having a one-on-one conversation with you and getting more detail. When we started to develop this model, I was looking at the literature on trauma and PTSD, and what I was seeing was that it kind of shocked me in the treatment studies for PTSD, that in the methodology section, I was seeing a pattern that they were noting that the amount of time between a traumatic stressor and when people report for treatment, when they seek treatment, was averaging about 10 years. So I started to realize, okay, maybe there's a pattern in people that when they have a traumatic stressor, they're going to try to take care of it on their own for as long as they can. And it might take years before they're willing to say, I need help. And so you might be seeing that as well, that people sometimes have to hit a wall before they realize, oh, okay, I'm not okay. I thought I was okay. And again, the adrenaline's going to be going, and they actually think they are okay. And so it might be really hard for you sometimes to be able to say, actually, you're not okay. As I said with the Oscar slide, if you can gather data to show the difference between the way they used to be and the way they are now, sometimes that can help. But you might be able to show them all this data and they still say, well, I don't know what to do with that. I still have to do my job. In which case, you may just need to say, okay, how can I help you do your job? And how can I help you with that? I really want to help you. So there may come a time as well where you might be needing to seek support from other family members and friends who are in similar circumstances where you feel helpless to help the person because they're not able to take your help at this time. They're not able to slow down or to say, yeah, you're right, I'm not okay. And so your job will be just to figure out that balance point for yourself and your family, how much you're able to tolerate, and maybe seek help for yourself as well until, one of the reasons I showed you that slide about the different zones of stress and people choosing their coping strategy dependent upon high emotionally intense context versus low emotionally intense context. You may not be able to support them now in the way that you want to until they get to a zone where they feel like, okay, I can now relax a little bit. And until they get to that point, they might choose distraction, like, I'm fine. I don't want to think about myself. I just need to do my job. And at that point, you have to figure out, okay, how can I help them with that? And it might be frustrating for you. So then you need to seek help for yourself, because you may be faced with this helpless feeling of not being able to help. So I'm sorry that's not as hopeful as I would like, but I would say that as you can slowly find little ways to support and move them, maybe they won't get to a place where they acknowledge that they're not fine, but they might get to a place where they're able to receive help nonetheless. Little ways that you can figure out ways to help them. So I'm reading the third question here from Kate, where it says, yellow reacting in the stress continuum includes the info about responding to multiple stressors at work and home. So learning about the difference between reacting and responding has been very important to me. You put a lot of thought into that continuum. Yes. What can you say about helping values and ideals people with harnessing or optimizing their world in light of their own internal constant oscillation between reacting and responding? Okay, that's a very thoughtful question. So reacting and responding. Okay. Again, this is a hard one to answer for me too, because I don't know you, Kate, and everybody's a little bit different in this. So what we know about reacting versus responding, and I hope this helps, is that if people can become aware of having little pauses, and the whole literature about mindfulness speaks to this, where they can have little pauses where they say, how do I want to move towards being able to respond versus just react? And typically people react when they don't have a sense of that pause and being able to be more self-reflective. And it sometimes becomes impossible when the pace is too fast, that they're just reacting. But if you can help them figure out ways to have a small little toehold of quiet or reflection or a moment to catch their breath throughout the day, they can start to wedge in a little bit of a moment where they can choose to respond versus just reacting. And for each person, that's going to be different. Some people are more resistant to having those moments of peace and quiet. Some people feel more comfortable in the reaction zone. And for some, that reaction, just reacting is actually a flow for them. They feel intuitively, instinctively, they just react, and that feels good to them. So this is tricky. That's why your question is tricky to me. But maybe you can help them see that reacting as a dance to things in front of them at work is different than responding to the needs, interpersonal needs of family and friends, or responding to their own internal needs. And so they have to react to some things and respond to others, which takes a moment's pause. So I hope that helps. It's hard to know when I can't see your faces, but that would be my answer to that question.
So we have another question that has come in, and it's, when you think someone would benefit from processing stressful experiences, but they do not want to, how do you encourage them without pushing them to an extent that makes them uncomfortable?
That's a great question. And this one is tricky too, and it's really, really a dance. Okay, as a psychologist who's been a psychologist for 20 years, I realize that each person has their own internal dynamic about things like this. And oftentimes it's based on childhood experiences and their attachment style and the ways that they feel comfortable in the world. And so it's particularly tricky as a psychologist in a relationship with another person, because I know things, and my husband's a veteran, and I know there are times when it would be helpful for him to talk about things, but he's not always ready and able. Sometimes it's helpful for you to get them in contact with mentors or other people that are in similar situations who've been able themselves to come to a place where they can process these things. And those people are often much better situated to help that person than you are, because they'll listen to those people because they respect that they've been through similar experiences. Whereas for you, they might not listen to you because they feel like you don't quite understand, or they also don't want to burden you. That's another tricky dynamic that can happen. They don't want to process it with you because they don't want to burden you. So you may need to figure out a patchwork quilt of ways that you set up the arrangements or the situations for that person, so that they're most likely to have someone to process these things with when they're able, when they're ready and willing and able to do that. It may not be you, or it may be that you set up an experience with them so that it makes it easier for them to process it. Sometimes it's helpful to give them options, to give them a checklist, to give them a structure within which to process things with you. So if you have a good relationship and they typically do process things with you, but the context is making it impossible for them, then maybe you can set up the situation so that it's easier for them to process it with you. Give them a menu, give them a checklist. If you know that they process things non-verbally, figure out ways that you can help them process things non-verbally. Send them a piece of clay if they're a sculptor, or whatever it is for that person. Make it easy for them. And like I said, you're going to have to problem solve and figure out what that means for that person. There's some research with first responders, for instance, where they said they prefer to process things non-verbally. They prefer to go fishing, to exercise, to do artwork, or to do things in a way that doesn't involve verbal processing but helps them to feel better. So each person's going to be different, and your job is to put your Columbo hat on and figure out, okay, how am I going to set up the circumstances so that it makes it easy for this person to do this? And if all else fails, then you seek help from others and brainstorm with others as to how they've done it with their person, or seek help from a mental health professional for yourself, because you may need to get the support. And maybe a mental health professional or a chaplain or a healer of some sort can brainstorm and problem solve with you about that particular person's personality. Okay, I'm going to stop there. I feel like I'm rambling because I can't see you, but that was a great question. Actually, all these have been great questions.
So we have a question that came in through the chat function. And this question is, how does peer support help? And are there resources out there to help find peer support?
So I would say peer support is particularly helpful for all the reasons that I've spoken about, that sometimes people in jobs like this only feel like they can get support from people who understand what they're going through. And so our stress first aid model actually is a work peer support model. It was originally designed for peers at work to help each other. And there are materials on our website about the stress first aid model, and we're making more, every day. So you may want to just introduce them to this model and say, hey, this is kind of a framework. If you guys can talk amongst yourselves, maybe get some training amongst your team as to how to take care of each other. These are the elements that are kind of universal. I mean, I can use these elements at home with you, but you can also be using these with your coworkers. And it's also a self-care model. So if they're aware of these elements themselves, they can start thinking about using them for themselves as well. There are lots of peer support models. This is just one of them, but I would suggest maybe in the work setting that they're in, that they start searching for peer support online and figure out what would make the most sense for their work setting.
So we're just about at time, so I think we'll have Karestan take over.
Well, thank you, Patricia. And thank you so much for a wonderful webinar. And thanks, Kristina, for moderating. Just to let people know, I really encourage people to go to the ptsd.va.gov website. As Patricia mentioned, there's also it's really my first stop for any information about trauma and stress and PTSD. We'll also have this webinar and the handouts that Patricia mentioned on our website, and Shaylee has put that in the chat. Next week, we will have a forum on love in the era of COVID-19, so focused on relationships and relationship conflict with Dr. Joanne Davila from Stony Brook University. And after that, we'll take a break on May 27th for graduation, and then we'll be in a bi-weekly format for June and July. So I encourage everyone to visit our website and for the resources and recordings of our forum. And Shaylee, again, just put that in the chat, and I hope everyone is able to stay well and stay safe. And thanks again, Patricia. Really appreciate it. Keep up the good work, and hope we'll get to see each other in person at some point. Thanks, Kristina. Take care, everyone.
Thanks, everybody.
Bye-bye.
Care.